Hi, my name is Robert Gregory Field. I'm a psychologist practicing in Westport, Connecticut and New York City. Today will be part one in a two-part series in which I talk briefly about depression, what it is and how to begin to understand it. Now, in spite of our apparent familiarity with depression, its complexities and variants render it something that cannot be simply defined. Certainly through the course of everyday life, people commonly experience a wide range of emotional ups and downs. Thus, in relation to some of those times of feeling down, the sense of what it means to be depressed is something that most people feel they can relate to and think they know about when they speak of it. However, those experiences of feeling down that commonly occur throughout life and actual depression are different in important ways. While sadness and feeling down may be considered expected parts of being human, depression is not simply an extreme version of these states. It is a significant illness that has other specific psychological and physical or physiological symptoms. Now, one significant difference is that while almost everyone has days in which they feel sad much of the time, typically these feelings are temporary. The feelings pass, and then we can have great days in which enjoyment in things can again be found. In these circumstances, difficult though they may be, the occasional bad day or days is a part of the normal ups and downs of life, and as such is not truly considered depression. But you may ask, what about those times when depressed feelings persist longer, for days or weeks, in relation to circumstances like the breakup of a relationship or being fired? Well, this may or may not be true depression. It may constitute an adjustment disorder with elements of a disturbed mood. This is certainly something that in itself would be appropriate to seek professional help for. What is true is that there are a number of clinically diagnosable depression subtypes, as well as disorders in which depression play a significant role. Determining which of these one may be suffering from is dependent upon the number, duration, and type of symptoms, as well as other potential coexisting conditions present. It's important to consult with a qualified professional, someone who can differentiate between everyday blues, adjustment disorders, and the variation in depression subtypes that can be diagnosed. Well, that's it for this talk today. Please tune in for part two of this general discussion on depression and how to begin to understand it. Please also note the link to my website below. It has information about me, how I practice, as well as contact information. Thank you.